send you all that post survey, get your feedback. This installment of the Crash Course series was actually taken from one of y'all's suggestions. And so I do take all of your feedback and take it into consideration and try to make things that are applicable to your life, to things that are going on. And so today we're going to just talk about strokes, give you some general information. But I do want everyone to know that, again, I am a social worker. I am not a medical professional. I am not a physical therapist. I don't do anything in regards to treatment or prevention of strokes. So if you have any specific questions about healthcare, about treatment, that's not covered in this presentation, I just would advise you to talk with your primary care doctor or medical professional to get those questions answered for you. The information I'm going to share with you today is from the American Stroke Association website. So I trust the information I'm giving you, but again, I personally do not have a skill set to answer specific questions about health. So just keep that in mind as we go through. Our Crash Course series strokes today, our agenda, we're going to define what a stroke is. I didn't know until I did this research that there was more than one kind of stroke. So we'll be learning together. We're going to learn about some risk factors, some that you can control and some that you cannot control. And then, of course, we're going to go through the signs of a stroke. Some of this may be information you already know, but just if you don't know it, hopefully you'll never need to know it. But if you do, I want to give that information to you today. We're going to talk briefly about the types of stroke. There's going to be 3 different ones we're going to talk about. And then, of course, the effects of stroke. We're going to spend a little bit more time on that. A little bit on treatment and rehabilitation, a few caregiver tips, and some resources. So let's see here. All right, so let's go ahead and get into it. What is a stroke? So stroke is a disease that affects the arteries leading to and within the brain. I thought, and I'm wondering if this is a common misconception, that a stroke happened in the heart. But a lot of the blockages that that create the stroke, they can start in the heart, but stroke actually takes place in the brain. So it's the number 5 cause of death and the leading cause of disability in the United States. So that's a lot of people who suffer through and survive a stroke. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or it ruptures, it bursts. And so when that happens, part of the brain cannot get blood, it can't get oxygen it needs, and so the brain cells will start to die off. And it says up to 80% of strokes can be prevented. So that's pretty interesting. So what are the risk factors of stroke? Well, there are risk factors that are out of your control when it comes to stroke. So one, age. The likelihood of having a stroke will increase as you get older. Although stroke is more common among the elderly, many people under 65 also have strokes. Even babies and children can have a stroke. Next, your family history. You can't control your family history. So if your parent, your grandparent, your sister or brother, anybody in your immediate family has a stroke, especially if it's before the age of 65, you might be at a greater risk. So sometimes strokes are caused by genetic disorders as well. Next, your race. So I didn't know until I did this training that African Americans have a much higher risk of death from a stroke than non-Black Americans do. The theory is because of societal barriers and systems that have prevented getting the proper health care that we need, that can lead to higher risks of high blood pressure, diabetes, and obesity. And the same is true for also Hispanic people. Limited availability of Spanish language health information can hinder efforts to prevent stroke. Next, gender. Women have more strokes than men, and stroke kills more women than men. So women do tend to live longer than men, and they're typically going to be older when they have a stroke. But there are several factors that may increase stroke risk for women, including pregnancy, having a history of preeclampsia or eclampsia, having a history of gestational diabetes, taking oral contraceptives, especially if you smoke while you're taking them. I know back in the day, they would say, if you're going to take these birth control pills, don't smoke because you can get blood clots. And so that was definitely, that can definitely up your risk as a woman if you're taking those. Even in the same vein, postmenopausal hormone therapy can also cause blood clots, can also increase your risk factor for stroke. Changes in hormonal status, some stroke factors that seem to be stronger or occur more often for women are migraines with aura, atrial fibrillation, diabetes, hypertension, depression, and psychosocial stress. And then again, prior heart attack or stroke can also increase the risk factor. And again, most of this is going to be out of your control. So what are some risk factors that you can control? So of course, this is going to be about how are you taking care of yourself? What are you putting into your body? What kind of nutrients are you giving yourself? So having high blood pressure, nearly half of American adults have high blood pressure or hypertension. That was shocking to me, nearly half. High blood pressure is the leading cause of stroke and the most significant controllable risk factor. So if you have a diagnosis of high blood pressure or hypertension, I'm sure your doctor has already told you that you have an increased risk of having a stroke. And so I just encourage you that if this is you, please take this very, very seriously, okay? It is, again, the most significant risk factor that you can control. Next, smoking. We've all been told for decades now how bad cigarette smoke is for us and for those that we love that are around us. So the nicotine and carbon monoxide in cigarette smoke damages your heart and blood vessels, and that makes you more susceptible to having a stroke. So according to a nationwide analysis of stroke survivors in the US, 58.8% of them had a history of smoking. So well over half had a history of smoking. Next, diabetes. If you have type 1 or type 2 diabetes, it's important to control your blood sugar. I'm going to butcher this word, but diabetes mellitus is an independent risk factor for stroke. Many people with diabetes have trouble controlling their weight, have high blood pressure, high cholesterol, all that increases your risk. So while diabetes is treatable, the presence of the disease still will increase your risk of a stroke, whether you're controlling it or managing it or not, just by having that. Next, diet. So of course, diets and high saturated fat, trans fat, cholesterol, all that can raise your blood cholesterol levels. Diets high in sodium or salt can also increase blood pressure. And those with high calories can lead to obesity. But diet containing 5 or more servings of fruit and vegetables per day may reduce the risk of stroke. And again, obesity, excessive weight, body weight and obesity are linked to increased risk of high blood pressure, diabetes, heart disease, and stroke. But they say that losing as little as 5 to 10 pounds can significantly affect your risk in a positive way. So even if weight control has been a lifelong challenge, start taking small steps today to manage your weight and lower your risk. Next, physical inactivity, which I know as a caregiver, you are probably very rarely sitting down. So this may not be something that you struggle with, but physical inactivity can increase your risk of stroke, your risk of heart disease, being overweight, high blood pressure, high cholesterol, and diabetes. And then high cholesterol. So cholesterol is the fat-like substance in your blood, and high cholesterol will increase the risk of getting your arteries blocked. So if an artery leading to the brain becomes blocked, that's what results in the stroke. And then finally, sleep apnea. So more than half of the people who have had a stroke also have sleep apnea. Okay, so if you have any of these diagnoses, these are risk factors that you can control. You can manage your weight, you can manage your activity, you can stop smoking, you can take your blood pressure medication if you're prescribed. All of this will help reduce those risk factors for you having stroke yourself. So what are the signs of a stroke? So the American Heart Association has this acronym FAST, F-A-S-T. So to spot a stroke, you want to first look at the face. Is the face drooping? So does one side of the face droop or is it numb? Ask somebody who you think might be having a stroke to smile. And if their smile is uneven, that's something to consider. Next is A for arm weakness. So is one arm weak or numb? You ask that person, raise both of your arms and just see if one drifts downward, okay? That could be a sign of a stroke. Next, difficulty with speech or speech difficulty since it's S. Are they speaking in a slurred way? Are they having a difficult time forming their words? And if you have all three of these, or I would even say maybe just one or two, it's time to call 911. That's what the T stands for. So stroke is an emergency. Every minute counts. So call 911 immediately and note the time when any of the symptoms first appear so you can give that information to the EMT when they arrive. So there are some other signs of stroke or other symptoms that you can watch for. So sudden numbness or weakness of a face, arm, legs, especially on one side of the body. Are they confused? Are they having trouble speaking or understanding speech? Are they having trouble seeing in one eye or in both eyes? Are they having trouble walking? Are they dizzy, losing their balance or their coordination? And are they experiencing a severe headache with no known cause? So these are symptoms that are going to be sudden. They're going to, the onset is going to be pretty quick. And so those are also symptoms to watch for if you think that your loved one or someone in your space is having a stroke, or if you yourself think that you're experiencing stroke. So what are the types of stroke? There's three main types. There is an ischemic stroke or clots, hemorrhagic strokes, bleeds, and transient ischemic attack, TIA, okay? So the ischemic stroke is what's going to occur when a vessel supplying blood to the brain is obstructed. So that's going to be that clot that's going to block that pathway to the brain. And this accounts for about 87% of all strokes. So the majority of people who have stroke are going to have this type. Next, the hemorrhagic stroke. They occur when a weakened vessel ruptures and bleeds into that surrounding brain tissue. So the blood accumulates and compresses the surrounding tissue, and this was the cause of about 13% of stroke cases, okay? And then finally, a TIA is a temporary blockage of blood flow to the brain. So that means that the clot is usually going to dissolve on its own or can get dislodged. And the symptoms usually last about 5 minutes or less. And so while a TIA doesn't cause permanent damage like a stroke would, it's what they call a warning stroke. And that signals a possible full-blown stroke ahead. So this is kind of like a warning sign for you. So if you first notice these symptoms, you want to get help immediately, even if the symptoms go away, okay? Because you want to get checked out, you want to make sure there's no damage, you want to make sure that everything's safe and you're appropriately working and things like that. But if you do experience something like this, or your loved one experiences something like this, even if the symptoms go away, that doesn't mean that you can breathe easy, right? That means that you need to make more proactive steps towards bettering your health so that you can decrease that risk of stroke, okay? So what are the effects of a stroke? Now, of course, everyone's going to be different. Everyone's stroke symptoms are going to be different. The recovery is going to be different. So these are just common effects, but you're not going to have every single one for every single case. So if a stroke occurs and blood flow can't reach the region of the brain that controls a particular body function, that part of the body is not going to work the way that it should. So how you're affected by stroke depends primarily on the location and the extent of damage to the brain tissue. So because nearly all of the signals from the brain to the body and vice versa cross over on their way to and from the brain, that means that each side of the brain is controlling the opposite side of the body. So stroke on the left side of the brain affects the right side of the body, and a stroke on the right side of the brain will affect the left side of the body. And if the stroke occurs towards the back of the brain, it's likely that some disability involving vision will result. So very quickly, we're going to go over some of these common effects of stroke. So if the stroke is in the left side of the brain, the right side of the body will usually be affected, producing paralysis on the right side of the body, sensory changes on the right side of the body, speech and language problems, abstract thinking, problems with thinking and memory, and slow, cautious behavioral style, okay? If a stroke occurs on the right side of the brain, the left side of the body will be affected, usually producing paralysis on the left side of the body, sensory changes on the left side of the body, vision problems, spatial thinking or imagery, which we're going to talk about that a little bit later, problems with thinking and memory, and a quick, inquisitive behavioral style. And in the brainstem, if a stroke occurs there, it can affect both sides of the body. The most severe damage could leave someone in a locked-in state. And so a locked-in state is a condition in which the survivor is generally unable to speak. They can't move because of paralysis of muscles, except for vertical eye movements and blinking. The person will remain conscious. They can hear, think, reason, and comprehend just like they always could. But usually the communication is established through eye movements, okay? So I would venture to say that's probably one of the worst case scenarios if you survive a stroke, that you get that locked in condition. So what are some physical effects of having stroke? So I'm going to have 2 slides about physical effect, or about the effects of stroke. The first one's going to be about physical effects, and the next one's going to be like behavioral and things like that. So there's something called spasticity, and that is a common post-stroke condition that causes stiff or rigid muscles. So it occurs when a muscle involuntarily contracts when you move, and commonly affects the elbow, wrist, and the ankle. So when a muscle can't complete its full range of motion, the surrounding tendons and soft tissue can become tight. So this, of course, will make stretching that muscle even more difficult. And if left untreated, spasticity can also lead to joints in the arm or the leg to be stuck or frozen in an abnormal and possibly painful position. And this is called contracture. Next, foot drop. So this is a common walking challenge caused by stroke. So people with foot drop, they can't raise the front part of their foot because of the weakness or the paralysis of the muscle that normally lifts it. So with foot drop, there's a difficulty what they call clearing the foot while walking, and that means they're going to often drag or scuff it along the ground. Strokes may cause a swallowing disorder called dysphagia. So of course, a lot of people, that's pretty common knowledge that if you have a stroke, at least temporarily, if not permanently, you may have trouble swallowing. And so you may have to use have a liquid diet and maybe increase thickeners as they rehabilitate. And so that's just something that affects the way that the muscles work in the throat. Of course, if this is not identified and managed, it can cause poor nutrition. It can also lead to pneumonia, surprisingly, and disability. Also, aspiration is a common for people who have dysphagia. And so what that means is once you swallowed something, it could enter the airway and the lungs. And so normally aspiration causes like a violent cough, but a stroke can reduce that sensation. So in this case, you might not even know that you're aspirating, and that's called silent aspiration, okay? The next physical effect is hemiparesis. That's a weakness or an inability to move on one side of the body. So that will make it really hard to perform everyday activities like getting dressed or eating. Next, something called claw toe. So many survivors report that their toes begin to kind of curl under their feet after a stroke. So of course, this is going to make walking a lot more painful. So muscles in the foot will overcontract due to an abnormality neurologically. Okay, so again, you're having that effect in the brain that's causing that physical effect in your body. So because toe muscles are typically not very strong, the contracting muscle will overpower the muscles in the toe. And so this will tighten the tendons and cause joints of the smaller toes to buckle and curl in an unnatural way. Next, it can affect fine motor skills. So those are how we use our hands and coordinate small muscles and control our fingers. So those skills, along with other arm functionings like reaching and grasping, they can be affected by stroke. And the stroke severity will determine the extent to the weakness of that fine motor skills. Stroke may also affect upper extremity functions like motor control, the perception of where your body is in space. This is known as proprioception. Here we go. Decreased sensations, shoulder weakness, weakness in the wrist and hand. Okay. Next, incontinence. So after a stroke, your loved one may develop incontinence, and this happens when muscles that control urine and stool are weakened. So unconscious leaking is the most common symptom, but there may be other types of bladder and bowel control problems as well. And then last, we have balance. So weakness can affect the coordination of the muscles that we need to walk safely. So changing in like your thinking or cognition can affect judgment and lead to unsafe decisions. Like maybe you're going to ignore the recommendation to use a walker or a cane. So if you get hurt, you also may end up hospitalized and admitted to a long-term care facility. So what are some other effects after a stroke? So communication disorders like aphasia and apraxia of speech, oral apraxia, those may occur, and that they can be kind of difficult to distinguish because they can actually happen all at the same time. So it can be kind of tricky to figure out what's actually going on. So I'm going to try to give you a very quick synopsis of what each one of those is. Okay, so aphasia is a difficulty using or understanding words. So that can, of course, cause problems with understanding other people, finding words to tell people what you need or what you're thinking, or even just reading or writing, okay? And apraxia of speech is also known as verbal apraxia. And so that's the difficulty initiating and performing the movements needed for speech, okay? That leads to problems in pronouncing sounds, maintaining the right rhythm, and the speed of speech. So the difference between aphasia and apraxia is aphasia is the difficulty understanding words, whether what you're hearing people say or saying the right words to convey what you mean. And apraxia is where you physically have a weakness or an inability to form the words, to actually move your mouth and your tongue in the way necessary to have that conversation. And so you're not confused as to what you want to say, and you're not really confused on what other people are saying to you. You're just physically unable to form those words, okay? Next, we have spatial neglect. So after a stroke, someone may lose awareness of things on one side of the body, and that's what we call spatial neglect. So it's also called spatial inattention problems. And after a stroke, it may be harder to detect other than changes. So one-sided neglect is more common with the right brain stroke, meaning that your neglect will be on the left side, okay? Signs of spatial neglect, trouble judging distances, such as missing a table when putting on a glass, or the size of objects, okay, it can be hard to judge that kind of stuff. Trouble understanding position and space and the rate of movement, that can also be challenging. So maneuvering around your home, even if you've maybe been there for 20 years and you haven't changed the way it's laid out, you could still have a difficult time navigating that space after a stroke, even if it's very, very familiar. You can misplace things on your affected side, overlook people or bump into things without realizing that they're even there. You can forget to put one arm into a shirt sleeve or dress just one side of the body. Even eating food on one side of the plate only, or you can read one side of a book or a page, having trouble finding your way around because you only notice doors, buildings, or streets on one side. And sometimes they can only process sound coming from one side, okay? So it's of course, people living with that probably don't find it fascinating, but just as an observer from the outside reading, I think it's very interesting how the brain can just, one side just doesn't bring in that sensory, and it doesn't process that sensory information, basically is what's happening. Next, we have memory loss, okay? That can happen because you're having damage to those brain cells. You can have difficulty concentrating. Oftentimes, people who have a stroke, they have a higher risk of vascular dementia. And if you were in on my the other dementias training, we talked about vascular dementia, and that's where that blockage in the brain causes dementia, okay? Because those surrounding cells, they're dying off, and so dementia symptoms start to increase. Next, we have pseudobulbar effect, or PBA. So those with PBA have involuntary bouts of crying, laughter, and anger. The effects are uncontrollable, and they can occur without any kind of trigger at all. The outbursts may be out of proportion, so something slightly sad maybe yields exaggerated weeping. But then on the flip side, sad or somber occasions might spur inappropriate laughter, okay? Or there could be rapid switching between laughing and crying. So often there is an understanding that the response does not match the feeling. So the cause is a neurological disconnect between the brain's nerve connections, or the chemistry, that will interfere with the accurate emotional expression. So if you have somebody in your life who has this PBA, you probably, you know exactly what I'm talking about, where just out of nowhere, they can have these emotional responses to things that just are not as appropriate as the rest of us, right? Like laughing at a funeral, or crying at something very, very happy, okay? And it can just come out of nowhere sometimes. But the good news is PBA can be treated. The first step is to get an accurate diagnosis, as always. You can ask your healthcare professional about PBA treatment options. And of course, educating anybody that comes into your home to help you care for your loved one or other family members, it's also very important. So you don't want anyone getting offended over something that they can't control. Personality and mood changes. So this can definitely happen after you've had a stroke. It's very common. So symptoms like impulsivity, apathy, PBA, anger, frustration, depression, that can affect a stroke survivor's quality of life. But of course, these challenges as well can be overcome by working closely with your healthcare team. And then finally, depression. Okay, a lot of times when people have a life-changing situation take place, and they have to reorient themselves in the world, and they have to accommodate for disabilities that they didn't have before. That can be very, very challenging to process. And so a lot of those sad feelings can come up, a lot of that feeling out of control, feeling hopeless, right? It can take a while for your loved one and even for you as a caregiver to really digest that information and accept the new normal that's facing you. Okay, so I would say depression is something that not only you should look out for in your loved one, but also in yourself. Okay, because we all know caregiving is extremely difficult. And sometimes you're in a caregiving situation where it's been that way from the beginning. Sometimes, it's a progression. And so, you have time to prepare, but oftentimes with stroke, it's very sudden. And so you don't have time to prepare. You don't have time to process it. You don't have time to think about it. It just happens and boom, there you are. And so depression can definitely sneak up on you in that space. So I would just encourage you to be very mindful and be very aware of yourself, how you're feeling, and find safe ways to process that stuff, okay? So treatment and rehabilitation. So a lot of times, well, I shouldn't say a lot of times, I think it's not uncommon for people to want to skip the rehabilitation and just make accommodations, okay? Which you can do whatever you want to do, but there is a lot to be said about rehabilitation and the treatment of stroke survivors. So the rehabilitation support that they receive can greatly influence the health outcomes and the recovery of your loved one. Stroke can affect so many different functions like paralysis and weakness, your gross motor skills, fine motor skills, speech, language, cognition, vision, your emotions, all that. And so appropriate quality rehabilitation with a strong team, especially trained to meet the needs of your loved one, will improve the chances for the best possible recovery. So for the first 3 months after a stroke, the brain is very much like a new brain. So that means it's ready to learn, it's ready to make new connections. That's a good thing. This ability for our brains to adjust is known as neuroplasticity, and it plays a vital role in recovery. And it can take about 3 months after a stroke for that neuroplasticity to return to a more normal state. After that, you can still work on regaining functioning and practice for improvement, but they will come at a much slower pace. So again, treatment, rehabilitation, time is of the essence. Not saying it's impossible to recover after 3 months, but you're going to see the most growth in that 3-month period after a stroke. So very quickly, what are some caregiver tips? So get informational support. Knowledge is power. That is your superpower. That is your most ferocious weapon when it comes to navigating your life after stroke. So increasing your knowledge about what a stroke is and what to expect can help you feel more in control and less overwhelmed, okay? Find support, ask questions of your care provider. What type of stroke did your loved one have? What side of the brain was affected? What caused the stroke? How does that affect their abilities? And how can you prevent having another stroke? Again, remember, if you've had one stroke, you have an increased risk of having another one. So one stroke might not be all you're dealing with here. Next, do your research. Strokes can be beatable, and rehab is key to achieving victories along the way to recovery. So during that journey, you'll have to make a lot of decisions and serve as an advocate for your loved ones. So it's very important to know what you're talking about and hopefully know what's coming down the pipeline for you. Next, find support from others. You guys have caregivers. You know this is, I'm preaching to the choir here, right? Reach out to your family and friends. Tell them what you're experiencing. Visits, phone calls, emails, or some other shared time can go a long way to help you feel supported and rejuvenated. And again, take time for yourself. So remember, I spelled remember wrong. Overlook that. I'll fix it later. Remember that caring for yourself is caring for your loved one, okay? Now, of course, in the beginning, you're probably going to get a lot of that time, okay? But just make a mental note that when you do have the time to take for yourself, take it. There's nothing wrong with that. It is essential to your caregiving stability, okay, to making it a sustainable thing that you can do. And finally, here's some resources. So I just have a few things here, but if you go on the American Stroke Association website, there is a huge amount of resources available to you, not only educational resources, but support resources as well. So here's just a few that I pulled out. First is the Stroke Family Warm Line. So you've heard of a hotline. Hotline is for emergencies. A warm line is for when you need a little bit of support, okay? So you can call between 8:30 a.m. and 5 p.m. Monday through Friday at 1-888-4-STROKE. So this family warm line will connect stroke survivors and their families and their caregivers with an American Stroke Association team member who can provide you support, helpful information, or just a listening ear. Because sometimes you just need to talk to somebody who knows where you're coming from, and that can go a long way in rejuvenating yourself so that you can continue doing what you need to do for your loved one. You can also go to the Stroke Support Group Finder at stroke.org. There's the information there. So that's how you can meet people who are on the same path as you. You can benefit from the wisdom and share your own, especially when you think about somebody who's been doing this for a while. And if you're coming into it, you know, brand spanking new, and you're freaking out and you're not sure what to expect, and you're catastrophizing, and you're thinking of all the horrible things that are going to be, you know, that are coming down the pipeline for you and your loved one, it can be a huge relief to see people who have been there, done that, and they're thriving, right? They're still enjoying their lives. They're still enjoying their relationships with their loved ones. And so just seeing that end result can often calm a lot of those initial fears that you may have. So you can explore how to make your experience smoother and easier to manage. And then, of course, there is the support network, and that is going to be a lot of resources for you, educational resources and things like that. And again, if you don't want to write all these hashtag, or not hashtag, but websites and stuff down, just go to the American Stroke Association, or yeah, American Stroke Association website. That's where I got all of this information, and there's so much more on that page, on that website, than what I've offered for you today. But I do encourage you to go there and see if there's some supports there for you, or some education that can kind of help you if this is something you're experiencing in your life. So that's the info I have for you today, short and sweet. I'll go ahead and stop my share and my recording.